Welcome to the new tutorial presented by the SchrDbb. In this tutorial, we're going to see labor. So, labor is an obstetrics tutorial, and here we're going to visualize the different elements in it. So, when you have a patient that has labor, is it clear? You are going to use the SchrDbb algorithm in order to visualize it. So is it clear? So in the algorithm, you start with the disease, then we go to differential diagnosis, then we go to endemic disease, then we go to the cause, then we go to the complication, and then we go to the background, and lastly we have the prognosis of the disease. Now this corresponds to this diagram where the disease of the differentials are going to correspond to the mechanism of the disease. Then we are going to have the pathogenesis. Then the next after pathogenesis, you're going to have the pathophysiology. Then later on, we're going to have the epidemiology, and then lastly the follow-up. So those are the different elements I'm going to visualize. So we're going to start by defining labor. So what is labor? Is it clear? When you want to define labor, there are 5 elements that you should put inside. Is it clear? So 1, labor is defined as the presence of uterine contraction. If you have a uterine contraction of increasing intensity, that's the second point. Increasing intensity and frequency. The first point is uterine contraction. The second one is the spontaneous. You have even the word spontaneous onset, because you can have also induced labor, which is artificially induced. So you have a spontaneous onset of uterine contraction. So spontaneous onset is one element, uterine contraction is the second element, or uterine contraction of increasing intensity and frequency is the third element. The fourth element is what? Associated with the fetal descent, resulting to cervical dilatation and cervical effacement, and then later on we have expulsion of product of conception. So those are the different elements you should put in the definition of labor. So let's start again. So labor definition, we have the spontaneous onset of uterine contraction. That's the first point. Second point is of increasing intensity and frequency. The third point is with cervical dilatation and cervical changes such as cervical dilatation and effacement and fetal descent, all resulting to the expulsion of the product of conception. So those are the different 5 elements that you should put in the definition of labor. Now after having a definition of labor, the next point now is to bring out the epidemiology. Now you need to know that labor is not going to have any epidemiology, so we're not going to bring out anything about that. Is it clear? So there is nothing to say that a woman is supposed to have any sexual intercourse with a male and then there is nothing like epidemiology of labor nor risk factors of labor. There is nothing like the cause of labor nor the risk factors of labor. Is it clear? So in this same tutorial, we're going to visualize other perinatal disorders. We're going to visualize perinatal labor complications. So I'm going to speak about that. Now the next one, now we have the mechanism of labor. So you need to know that every time that you have a history, when you want to speak about the clinical presentation of labor, so you need to know that this element. So we have the clinical presentation of labor. That is what we are going to mostly deal with. Now we need to know that the clinical presentation of labor starts first with the symptom, then we are going to have the sign, basically, and all that can be visualized from the history and then the physical examination, basically. Now, what are the elements that you must bring out in the history and the physical examination of a patient in labor? So when you finish the history and the physical examination of labor, you need to conclude with certain elements. The first element is the power, the second element is the passage, and then the third element is the passenger. So by the end of your labor and by the end of your history and the physical examination of labor, you must end up by speaking about the power, the passage, and the passenger. Is it clear? You must speak about all these three. Is it clear? So in the history, generally in the history, we just describe the power in the history. So you need to know that what generally, when you want to describe the power, what are the things that you describe for the power? You need to know that what when talking about the power, you're talking about the uterine contractions. Is it clear? For the power. When talking about the power, you're talking about the uterine contractions. And the element of the power, and the elements of the power, you're going to have one, the intensity. You must speak about the intensity of it, or you must speak about the intensity when you're talking about power, the intensity of uterine contraction. You have the duration of uterine contraction. The third element after duration of uterine contraction, you can speak now of the frequency of uterine contractions. Is it clear? So those are the three major elements that you must speak about when you speak about the power of uterine contraction. Is it clear? So in your history, you say that what the patient presented with lower abdominal pain. So let's say that is a low abdominal pain of 3 hours duration. The history dates back 3 hours or consultation when the patient had low abdominal pain. For you to understand best of it, you go back to the TikTok account of SchrDbb or OBG and Obstetrics and Gynaecology. You're going to visualize it. Is it clear? So now, when you describe the duration, normal duration of labor has to be between what and what? It has to be between 40 to 60 seconds. If it's less than 60 seconds, it means that it is brady. Is it clear? You have a brady contraction. If it is more than that, it is tachy contractions. So we have the frequency. The frequency now is the number of times normal labor has to be. It has to be 2 to 5 times every 10 minutes. You have to have 2 to 5